Most people who are looking for a massage chair are looking for one to take care of low back pain, mid back pain, neck pain. But what most people don't realize when they're looking for a massage chair or even considering a massage chair is that it can help other pain syndromes. Of course, it can also help relaxation and stress, but headaches, sciatica, wrist pain, forearm pain, knee pain, foot and calf pain. These are all areas that can be helped by a massage chair. Now, I've already done a video on headaches and massage chairs, but let's talk a little bit about sciatica. Sciatica is an irritation of the sciatic nerve that goes from the low back down the leg. And when you have true sciatica, you're going to feel pain in the up in your thigh and as far away as the buttocks, the thigh, and as far away as the calf, and possibly the feet. Now, the sciatic nerve can be irritated in a number of ways. It can be like a cancerous growth that's impinging on the nerve. It can be arthritis, degenerative arthritis, where the bone spurs are irritating the sciatic nerve. It could also be degenerative arthritis in that the discs may have thinned, along with bone spurs growing, which can irritate and impinge on the sciatic nerve. And one of the most common ways is the piriformis muscle. The piriformis muscle is a muscle down in your buttock area that goes from your hip to your sacrum or your tailbone. And that muscle, when it's contracted and tight, it can irritate the sciatic nerve. And so you can get referral of pain down your leg from that contracted muscle. And in some people, a large percentage of people, the sciatic nerve goes right through the piriformis muscle. And so that sciatic nerve can become irritated when that muscle gets spastic or contracted. Now, this is a fairly common situation. You might have heard of piriformis syndrome. That's not uncommon for athletes, for expectant mothers who are experiencing the growth of a baby in their body, and it's spreading their hips out to accommodate the growth of the child. That can result in biomechanical dysfunction, which can affect the way that the hips move, which can affect the way that the piriformis muscle functions, and can affect the tightness of that muscle. So a massage chair can do a couple of things in these situations. It can the rollers will go down your back and underneath your seat, and it'll hit those glute muscles, the butt muscles, including the piriformis. And when the rollers repeatedly go over that muscle, it can relax the muscle. And if that's the reason for your sciatica, it can relax the muscle and it can release the impingement on the sciatic nerve. Also, if you have degenerative changes in your spine, and that's the osteoarthritis I was mentioning earlier, the rollers don't fix the arthritis, but what it does is the rollers induce motion into those segments. And so now those segments, which are slowly degenerating over time and slowly coming to fuse, now have rollers that go into that area and roll and move those segments. So now you're getting some movement that ordinarily you wouldn't get if you sit all day in a job, or as you get older, as you know, it gets harder and harder to turn and your motion is restricted. Well, the chair can increase the movement of those segments, thus allowing the spine segments to move more freely, perhaps relieving some of the tension on the sciatic nerves or the roots of the sciatic nerves, and that can also give you some relief with sciatica. Anyways, that's something that very few people know about, but people that have owned massage chairs or that own massage chairs and have sciatica have commonly given us feedback that it has relieved their sciatica pain. So I find that fascinating, and that's something that most people don't even realize. Anyways, I hope you found this video helpful. I'm Dr. Alan Weidner, and I will see you on the next video. Bye-bye.